So we're going to shift gears now, and I'm going to ask Staci Berger and Carlos Rodriguez and Carolyn Beauchamp to come up front and join us. And we're going to hear the insights from our service providers. And we were talking and prepping for this, and Craig said to me, it sounds like it's sort of an Ignite session because we've given them a small amount of time, and I know they could tell a whole lot more. But they're going to share with us, again, sort of what the situation is now, what's working. And it may not be necessarily something that's happening in New Jersey, but it could be something that's happening in New York or in other communities for people to learn from. So thank you, all three. And we'll start with Staci and then go to Carlos and then to Carolyn. And I need you to speak right into the microphone, even closer. Sorry. Thank you. That's great. Thanks very much. Go ahead, Staci.
Sure. Thank you, Nina. Thank you all so much for the opportunity to be here this morning and to share the network's analysis of what our state faces in terms of our housing needs 18 months after Superstorm Sandy. As President and CEO of the Statewide Association of Housing Community Development Organizations and our allies, working to create homes and jobs for lower income residents in the state of New Jersey, I've testified at a lot of public hearings in my time, but nothing really prepared me for August of 2013. That's when I met Simone Daniker and Leanne Newland for the first time. We were asked to testify at a joint legislative hearing to talk about the recovery. These two working mothers came with me to talk about their experience. Both of them were being helped by our member, the Affordable Housing Alliance, to recover. The Affordable Housing Alliance is one of the many organizations that's been working with folks since the storm hit. Neither Leanne nor Sandy nor any of the people here who testified before I got up here had spoken in a large group like that before, and they were understandably nervous. So I gave them my standard advice, which is to speak from the heart and tell their truth, tell their story, and understand the people in the room, put their pants and their pantyhose on one leg at a time. Despite having testified a bunch of times before, I really was not prepared for the reaction to their stories. Each of them cried, and frankly, so did I, as they told their heart-wrenching tale of struggling through the RREM program, the state's major rebuilding program that you've heard about before this morning. Leanne talked about filling out 10 pounds worth of paperwork, which had been lost, transferred, turned over to the wrong person. The person wasn't there anymore. Every time she made a phone call, she got somebody different and got a different answer. She and her family were struggling to figure out how to rebuild or whether they could rebuild their Shark River home, as well as how to restore their nonprofit musical charity that worked in schools. All of the instruments that they had used for that charity were stored in their basement, which was flooded, and everything was lost. All she really wanted was someone to tell her what her choices were, how to evaluate her financial options, whether they could rebuild, and to make her feel like a human being and not like a number. Or in her words, to not be made to feel like a criminal. Simone's family had been the victim of a predatory loan prior to Superstorm Sandy hitting. So they were already literally and figuratively underwater and trying to figure out whether they could keep their home, even as it had almost no value. Simone grew up in Union Beach. Her husband grew up in Union Beach. She raised their kids there. They raised their kids there, and they wanted to stay. If it hadn't been for the Affordable Housing Alliance trying to help her resolve the foreclosure prior to Sandy, she might have already been out on the street. She frankly couldn't get anybody at the state to tell her what she was supposed to do or how she was supposed to do it. She told the committee that rebuilding from Sandy felt like a second full-time job. She would come home from the bank and then go to work on rebuilding her home. Frankly, everybody in the room was sort of shell-shocked by their stories, because mostly what we had heard in the press at that point was that things were going along swimmingly. And here were people who were willing to get up and tell their story and talk about how really heartbroken and lost they were. As soon as their stories hit the papers, our phones started to ring off the hook. Our members' phones started to ring off the hook. My inbox was filled with people's similar stories, which clearly indicated to us that tens of thousands of people were not getting the help or the resources to which they were entitled. They were not getting, most of all, the help navigating the system, making sure that they were able to access the funds that so many of us fought to get from the federal government. In some ways, Simone and Leanne were actually sort of lucky. At least they had programs that were dedicated to helping them. The RREM program and the resettlement program were set aside for homeowners to help them rebuild. But renters, who comprise 40% of those affected by Sandy, have no direct assistance program set aside for them. A New Jersey family needs to earn about $50,000 a year just to afford a two-bedroom apartment at fair market rent in our state. Most of the renters who were harmed by Sandy earn less than $33,000 a year. 67% of renters who were impacted by Sandy earned less than $33,000 a year. So they are already people who are housing burdened, struggling to decide between heating and eating, and now they really can't find anywhere to live because in Monmouth and Ocean County in particular, the vacancy rates were already so low before Sandy. We have a real market imbalance where there aren't places for people to live, even if they could afford to live there. The price goes up, and people have not enough resources to make those choices. Unfortunately, the state's recovery programs are really mismatched between the housing needs and the resources that are available. We found that a startling 80% of the people who applied for RREM were unfairly rejected, paperwork was lost, files were incomplete through no fault of the homeowner. Even more disturbing, the racial and ethnic breakout of that, African Americans who applied for REM were 2.5 times more likely to be rejected, and Latino applicants were 1.5 times more likely to be rejected than white applicants. The state has not really explained why that happened. HUD did recently release a report that showed that they did a lot of outreach, primarily in Monmouth and Ocean and Atlantic counties, and that may have led to a higher application rate from wealthier homeowners, but it doesn't really explain the rejection rate. So we need some answers on those questions. We've also heard significant problems from manufactured homeowners who were told in some cases that they just simply weren't eligible when in fact they were. The RREM program guidelines for manufactured homes did not come out until after the RREM application deadline was over. I had one woman, Wendy in Moonachie, tell me that she was told that she wasn't eligible for that program because that was only for real homeowners, and she wasn't really a homeowner. So she was living in her trailer with damage from Sandy, waiting to find out whether or not she was going to be eligible to get any kind of assistance. So there's so much work left to do that we can do together to make sure that our communities rebuild and that people get back on their feet and back to their lives. We need to ensure that our recovery is fair, that it's transparent, that it's equitable, and that we provide residents with the resources and the help that they need and deserve. So many people have so many questions, and they're left to fend for themselves. Many of you in this room have supported education and advocacy work that has helped decision makers get to these points, but there's one area that we really can benefit from and that we can all work together to secure, and that's housing counseling. In New York City, the New York City model, the Build It Back program, which is comparable to New Jersey's RREM program, includes housing counseling as an automatic part of their program. So to the gentleman's question earlier, how did people find out about the services that are available? When folks apply in New York for Build It Back, whether it's a homeowner or a renter, they are automatically connected with local collaborations of services through a center system. So they are actually farmed out to the right service agency that can give them the help that they need. So if our long-term recovery groups were being supported by the state, and our housing recovery centers, which is what we've proposed, were supported through the rebuilding process, we would be able to have people connected directly with the services, and they wouldn't be left to chance or whim or an email that came into Mrs. Schaefer that she just happened to see. That's not how a good recovery works. A good recovery connects people to the services that they need, that they're entitled to, and helps them get all of the services that will make their lives whole. We estimate from the work that our members have done that we've got about 20,000 folks who could benefit directly from housing counseling, renters, landlords even, RREM and RSM participants. If we took all 20,000 people who could benefit from some housing counseling, we would be at a rate of about $750 per family, which is what we estimate based on previous counseling services. We could serve most of the folks, if not all, for less than $15 million. That's less than what we spent on HGI, which, as most of you probably know, didn't do a great job on our housing recovery. So we could do a lot with not a lot of money, but we need philanthropy to continue to be great partners. We've been very fortunate to be part of the New Jersey Recovery Fund grant process, which has brought a lot of folks together to collaborate and work across a really diverse spectrum of interests and gave us an opportunity to meet people and work together. We need you guys in the room to continue to fund direct services as well as advocacy, but also housing counseling as one mechanism to make sure that people get the help that they need. I'm getting the high sign from the back, but I did just want to tell you that Leanne and Simone were able to get into the RREM grant process, and we're really glad that they're able to do that, but there needs to be more success stories like theirs, and with your help, we can make sure that that happens.
Thank you, Staci. So my name is Carlos Rodriguez, and I have the pleasure of serving as the Executive Director of the Foodbank of Monmouth and Ocean Counties. and the privilege of leading and working with 40 team members in our organization, but also 300 partner agencies throughout Monmouth and Ocean counties. I'd like to just recognize very briefly the Rivera and Schaefer family for your compelling words and for really giving a personal perspective on the problems that I'm now hopefully going to give you more of a macro understanding of how many of these families are we really talking about, and how has the problem of hunger and food insecurity been compounded. You know, when you stop and look at the numbers of who's hungry and who's food insecure, and food insecure is actually kind of like a government kind of wonky metric that's used, and we use it as kind of a good bellwether, right, Kathy? Kathy McMahon from Community Foodbank of New Jersey. But what it stands for is just a number of families that have uncertain access to enough food for an active and healthy life. Pretty good bellwether, right, when you're dealing with issues of hunger and trying to gauge how much of a population is going to need your services. If you look at New Jersey compared to the rest of the country has about 1 in 6 people are food insecure. New Jersey is about 1 in 8. About 1.1 million people. That's no number, but we're a little better than the rest of the country. If you look at Monmouth and Ocean counties, it's about 1 in 10 people in Monmouth County, 1 in 9 people in Ocean County. So it looks like, you know, we have a problem. We definitely have a problem, but it doesn't look like it's as bad as maybe the whole national average. When you start looking at the numbers of children that are food insecure, the picture starts getting a little different. There's 1 in 5 in the U.S. There's actually 1 in 7 in Monmouth, 1 in 5 in Ocean, and 1 in 5 in New Jersey. And so the number starts aligning a little bit more. You have more of our youth dealing with the problem of food insecurity. And food insecurity doesn't mean that you don't have access to any kind of food, as I mentioned. It means because we have a network of pantries and soup kitchens and emergency food providers, it may mean that that's where you're getting some of your food. And it's episodic. Hunger is very episodic in this country. You come in and out, as you heard earlier this morning. As you need, you go in, and as life changes, you may be able to go out. You don't have to be as reliant on food. And it's regardless of the disaster. So we're talking about Sandy today, but life's everyday disasters could include job loss, any kind of disability, change in the makeup of the household, retiring. Very recently, post-recession, retiring can actually lead you your portfolio planned for a very different day before you retired, and then the recession hit at the same time. And that creates for a different reality. But if you look at the numbers in New Jersey a little deeper, if you look a little deeper at the numbers, and you start looking at what's really going on in what's New Jersey. New Jersey is a suburban state. If you look at the numbers, you'll see high concentrations, the highest concentrations of food insecurity in urban areas. Absolutely. You see a growth of over 11.7% in the last 5 years in urban areas. The places that we all know have had long-term issues. Camden, Essex, Hudson, Passaic counties, for example, and those urban areas. And the growth is still there, and the numbers are unfortunately very large. But if you look at what's been going on in suburban communities throughout New Jersey, in the same time period, you have the percentage of population that's 200%. That's the definition of low income, 200% of poverty, has gone up by 17.3% in the suburbs. 17.3% versus about 11.7% in urban communities. And so that means that more folks are sliding down into this low income. And I mentioned that 200% of poverty, because between 200% of poverty and everyone that we serve through our network, that's kind of like my red area. That's how I know whatever that 200 number is, that's how high the number that could come at any one of our doors can balloon up to. And so that's always my danger zone, if you would. And when I look at a 17.3% increase in low-income populations in the suburbs, I get really nervous. And I know my colleagues in food banking around the state and around the country, in fact, also get a little bit of nervous. Let's look deeper at what's going on in suburbs. 55% of SNAP, formerly known as food stamps, recipients now live in the suburbs as of 2011. From 2007 to 2011, 100% increase in SNAP recipients in the suburbs versus 69% in urban communities. So still growth, still overwhelming number in urban communities, but what's going on in the ring around the urban communities? And there are some very unique barriers to services that are different than in urban communities. There's less density of services available in the suburbs, in suburbs versus urban areas, and transportation becomes a very different challenge. So that's the backdrop. We all know what the impact of hunger means. On children, it means that they're sick more often, they get more headaches, they're less likely to learn. These are things that have compounding effects on a community as children are less able to learn and progress through those very critical developmental years. And for adults, we know that and children as well, we know that they're more susceptible to obesity, which is linked to diabetes, heart disease, and have other long-term health consequences. And we heard why. When you have limited choices or you're being moved around from one environment to another, sometimes you have limited access to cooking facilities, and you have to make choices. In Monmouth and Ocean counties, just a couple interesting quick facts. In Ocean County, it's the fastest growing county in New Jersey. The median income is about 30 versus 35 for the rest of the state. 1 in 4 residents are low income or at below 200% of poverty. Child poverty, since from the previous census to this current census, doubled from 10% to about just under 20%. And we have the second highest number of seniors nationwide, second only to Dade County in terms of concentration of population. We also have 13% in Ocean County of New Jersey's veterans. So some key issues. When you think of these populations, you think fixed income, you think limited access, and you think that they're really on the border of being able to solve problems. Monmouth County has its own share of issues and complexities, one of which is vacancy rates. So what happens when you have a 99.9% occupancy rate in terms of housing costs and market realities? We have 1 in 5 residents are low income in Monmouth County. There's 30% increase in poverty from over the last decade, and 18% increase in child poverty. The per capita income over the state average is 43 versus 35. So there you have a really interesting set that tells you what the environment looks like. You have a high concentration of wealth in some cases, but you have also folks that are trying to make do in that same environment or in that same demographic environment. What happens, these are all, by the way, just to ground you, these are all pre-Sandy statistics. So this is what was going on leading up to and through the recession. Enter Sandy, and the story that we've heard is that the what's called ALICE households, asset limited, income constrained employed, this low income population, again, they were worst off. When you look at all households, what their unfunded portion was in terms of trying to make themselves whole and rebuild, it's about $887 million. When you just look at the low income population, this ALICE household, and look at what it would make to make them whole versus the resources that the expenses that they saw, the expenses that they recognized, the resources available to them, it's $2.2 billion. So when you look at the whole, it's 887 million. When you look at the low-income population, they actually need 2.2. And why is that? Many of them didn't have insurance. They needed it, or they didn't qualify for it, or they couldn't afford it. And they also didn't have any flood insurance, didn't have any regular insurance. 69% and 90% didn't have any flood insurance. They had no savings to cover losses. So when you look at total resources, it includes savings, equity, and whatnot. A lot of that might have been wiped out during the recession, if you had any to begin with. In Monmouth and Ocean counties specifically, we have over 40,000 structures in Ocean County alone and 10,000 in Monmouth that were damaged. According to FEMA, that's 68% of the state's total damage. So this is now post the stats I gave you. This is the environment kind of leading into the reality. 18 months after Sandy, we are still serving 4,200 families, anywhere between 12 to 15,000 people through our network of pantries and emergency food providers. And the need still continues to grow. Why? Because people first chose to max out credit cards, to deplete their 401ks before they can find or get themselves to this program for many number of complex reasons, which we touched on. Maybe Carolyn will probably touch on even more. Solutions to hunger. So what works? I mean, very simply, what do we do at the food bank? We do two things. We feed the lines that are unfortunately getting longer, and we work to shorten the line. That's what we do. Feed the line. Obviously, we work to provide food to well over 127,000 people. Those are pre-Sandy stats. Again, we expect about a 10 to 15% increase in Sandy, and it looks like it's going to be a sustained increase from what we're seeing early on. And we work to shorten the line. Our approach to shortening the line is very simple. We provide employment opportunities through a culinary training program. We know that works. But more importantly, we use our network, and we're organizing our network to be able to identify families, because they come to pantries and to the programs that make up our network before they find some of these other programs, the 10 pounds of paper that we have to fill out. And we help them engage into other resources that we know that work. Financial resources. Everything you've heard here today speaks to lack of financial access. Lack of financial access to rebuild your home, lack of financial access to be able to shop the way you and I shop in our local markets. So we connect people with food stamps. Why? Because this is the population that never thought they needed it, and now they do. And that's why that safety net is there for. We launched a free tax assistance program. Why? Because the Earned Income Tax Credit lifts more people, more working families out of poverty than any other program in the country. And there was nothing in Ocean. There was no VITA program in Ocean County, and a very limited program in Monmouth County. And they were limited, and even before Sandy. So Sandy exacerbated the need for these type of services. We also did something a little crazy. We became a healthcare navigator, because 47% of the families that we serve said that they have high unpaid medical bills, and it was a contributing cause to being hungry. So hunger doesn't live in a vacuum. Hunger very much is related to all of these things that we know safety nets are supposed to address and work opportunities are supposed to address. What we propose in the food bank is a more collaborative model and an integrated model. So we're seeing 1 in 10 residents already. Let's build a system where we can identify the clients, honoring their experience and their reality and their perception, and connect them to the resources that we're around. Because as not-for-profits, I'll share with you a little secret, we spend a lot of time on outreach. So can we do it a little better? I think the answer is yes. And people don't normally connect to, even if you're hearing, you're not listening that program is for you. So to the great question this morning on Atlantic County, from the Atlantic County long-term team, people hear it, but they're not listening because they don't relate to those programs. I heard that very distinctly this morning. So what can we do to be more collaborative and more integrated? Exactly what I mentioned, work a lot more together and start integrating these into the streams and start doing more of, hey, I see folks, let me refer them to you. I don't want to do all these things, but I can easily partner with my friends in housing and do the referrals because I'm seeing the person at a line. Or I do these programs where I'm engaging large-scale working families and I can route them to other folks. Why do we do this? Our food distribution has tripled in the last 7 years. I was up in Bergen County yesterday talking to our friends a pantry, and they said, ours too. And we hear from my friends at Community Food Bank, they said, our numbers are going that high as well. And so we need solutions that not only address the immediate need of the problem with food, but we also have to go beyond and look at strategies that help shorten or hold the line. And for us, the first step is connecting to these resources. Very quickly, I'll give you an example of two adults, 2 children, with any combination of wage earners making about 130% of poverty. That's about $2,600 a month. That's about 130% of poverty for a family of 4. Before any benefits or any of these income support programs, with a modest rent of $1,500, that's about modest, right? $1,500 a month in rent. That's lucky.
That would actually be low.
That would be low.
Get that. Not in Monmouth County.
They're, before taxes, their available resources for anything else, I'm just counting income and rent, would be $1,000 a month. So out of the $2,600, to $600, you have to pay taxes, so you're not netting that. That's gross. So at the end of the month, you only have $1,000 to feed, to clothe, to travel, to get to work, et cetera. With some very modest income supports, the programs that I mentioned, SNAP, and a modest tax return with some of the credits that I mentioned, a family will go from 130% of poverty in terms of resources to 185% of poverty. So these programs work. It allows a family not to worry about putting food on the table, but working on their employment situation or bettering their employment situation. It allows them to stabilize their housing situation, maybe by paying some back rent or getting ahead of rent. It allows the family to pay for that college tuition so that the cycle is broken. So that's what we're talking about with these type of programs. I mentioned these in a so we know these programs work, but remember what I said about the suburban communities. The infrastructure is not there the way it is in other places. And that's the difference, whether it's the human service sector on the government side or on the private side, it's not there. We have an opportunity now, and we're engaging it around the room in terms of our provider partners to collaborate and integrate in a very unique way. And the impact can be seen on the example that I gave you, but more importantly, on the stories that you heard this morning. So thank you.
Good morning. I'm really pleased to be here with you this morning. I'm Carolyn Beauchamp. I'm the president and CEO of the Mental Health Association in New Jersey. And I think that the first thing I'd like to say is that there's no way that we can separate mental health from housing, from food. If we're going to help people regain their stability, these two qualities, these two entities have got to be stabilized as well. And what we know through the Mental Health Association and through our work is that at this point, finding the stable housing that people need is one of the biggest issues that's creating problems for people's emotional stability at this point in time. Let me just tell you briefly, the Mental Health Association in New Jersey is a statewide advocacy organization, private nonprofit. We work through training, education, advocacy, support programs, and we've been involved in disaster response and training since 9/11. With the advent of the hurricane, we were probably from the very beginning involved with FEMA and the Hope and Healing program, and that is the emotional response component that was in all of the impacted counties. We were probably the major player in that. So we learned over time, and obviously since for the 18 months, I'm just trying to play with this a little bit so that I'm not shushing at you. We had a strong sense of what was working and what we would like to change as we worked through the FEMA program. The Hope and Healing program stopped February 14th in terms of FEMA. It was an enormous loss and a real void for folks. The concern that we had was mostly in the South because, as you're hearing, the counties in the South were the most heavily impacted, and we had been very active in Atlantic, Monmouth, and Ocean counties. We were very lucky through some of the help in this room to continue programming through something called Our Post. And we took our experience through Hope and Healing and expanded it so that when I talk to you about what I think the priorities need to be now, we're piloting them in Atlantic and in Ocean, and we've taken the crisis intervention and the emotional support component of the FEMA program and pulled it into something wider and much more long-term for people. So the first priority that I would talk to you about is the ongoing need to identify people who are still in need of being engaged in services. We are finding in Ocean and Atlantic that we are still, the grassroots outreach part is absolutely crucial, and I know it's crucial in all the counties. We are able to identify the most vulnerable populations, the elderly, people with disabilities, people with mental health issues, and children as our target audiences. And what we've done is match people as volunteers and as paid employees of ours. So we're asking elderly people to reach out to elderly. We're asking people with mental illness or who have a history to reach out to those with mental illness. And I can reference back to, I think, Mr. Schaefer was his name, the sense that if someone hasn't walked in your shoes, it's really not comfortable to talk about some of these very difficult situations. And that was one of the reasons we felt it was important to match populations. So we have people out going from house to house, working with community agencies, and still finding folks who have never been engaged in any part of this recovery effort. And that's abominable. I mean, some of these folks have never been involved with social services, with the community. So we're finding people for the first time. That was one of our changes. We're also doing much more, not just emotional support, and we've always done that, as well as trying to help people get into groups that are recovery groups of people going through similar experiences. Again, to Mr. Schaefer's experience, you really want to talk to people who've had some of the same trials and tribulations that you've had. So we're continuing to do that. I think one of the more significant pieces is that people need, and I can call it care management, case management, whatever you like better. I think I like case management better. So that we're now helping people fill out applications for housing. We're advocating for people. We weren't allowed to do that with FEMA. We're advocating for people around the housing issues, around insurance issues. We are staying with them ongoing so that whatever comes up, we're able to help them deal with. And we're also recognizing when there are emotional problems, moving them on to counseling services that exist. So we really feel like for this vulnerable part of our population, we're able to provide pretty comprehensive services. The second priority is, also mentioned by my colleagues up here, there has to be collaboration, give and take, and coordination among the services and the agencies. And, I've been accused of always being on the positive side. And I think that's one of the ways you find solutions. If you're constantly talking about what isn't working, you need that. You need to know what doesn't work, but then you need to move on to how do we make it work? What do we need to change? Our case managers are very involved with agencies throughout local communities, county communities, and one of the biggest players is with the long-term recovery groups. And I would suggest to the gentleman that would ask, who was saying, how do we get more information out about long-term recovery groups? Our post workers are in Atlantic County, and I can give the word to them that you feel that you're not getting referrals as quickly as you should, and that may be of help. I think marketing is one of the hardest things to do. How do we get people the information? We don't necessarily have resources, and the resources we do have, we want to use for service. So it's always hard to get the word out the way we want to get it out. I'd like to describe a little bit about our relationship with the long-term recovery groups. And I can only speak at this point for Atlantic and Ocean, but I think it would be wonderful to have it in all the impacted counties. Every one of them, I believe, has a long-term recovery group, and they are incredible. They are, for the most part, volunteers. They represent all aspects and capacities in that county. They're dealing with almost everything. I mean, it's an enormous effort. So what we do is we refer our clients to the long-term recovery groups when they need those kind of services, and we link them. There's a case management service that's very helpful with long-term recovery groups. There's every kind of service with long-term recovery groups. So that's what we give to them. The piece that comes from long-term recovery groups to us has to do with the fact that they're mostly volunteers. They need to be trained around mental health issues. We are very lucky in that we are providing mental health first aid as a primary training tool to help the public and to help specific entities like volunteers learn how to identify problems, mental health problems, what to do in that instance, and how to refer. So long-term, in fact, we've just trained, I believe, in Middlesex, in Bergen, in Ocean, long-term recovery group volunteers, so that as they're working with people, they can recognize this is an emotional problem, this is how I need to respond to it, and this is what the referral should be. Very much like first aid. In first aid, you can be in the public, you don't know the person, or you may know something terrible happens. What do you do? Same thing with mental health first aid, only we're trying to make it a public, much broader recognition and learning experience. So that's the third piece, priority that I see. We need the public to be much more aware of what the emotional concerns look like, of what their response might be to be helpful, and then of how to refer. So if we can engage the public more, what we're doing is bringing mental health into the world and not seeing it as this sidebar over here that nobody really wants to talk about or deal with. And I think, frankly, one of the things that's come out of this disaster is that mental health has really risen to a level of being a very important, a recognition. This is a very important issue we have to deal with. I have a very brief story, and I'm going to end with that. My staff in Ocean and Atlantic counties went out initially right after the disaster happened. And once we had FEMA grant, we started calling mayors, calling probation departments, calling all the big stakeholders and saying, we're here. We can talk about emotional, come in and do work with emotional response. Their answer was, we don't need that. This isn't a mental health problem. We need to deal with those issues that are concrete. We need to talk about housing and whatever. 6 months later, I was at a staff meeting where we had Atlantic and Ocean, and we had all the peers there. There were 50 people in the room, and they were telling me the stories of how when they walk into their offices in the morning, the phone's ringing, and it's mayors, and it's officials from towns, from counties, and they're all saying, I have a meeting I need you at, I need you here, I need somebody representing you here, I need you for this, I need you for that. And we're now talking about emotional response. We're not talking about mental illness. We're talking about an emotional response to a crisis. I see that as an enormous way to reduce stigma and to be aware that emotional responses are very natural. So I've seen that as great progress. Thank you.
Thank you. Thank you so much. A lot of great, great information. Questions? We do want folks to use the microphone. And if you could introduce yourself.
Good morning. I'm Bonnie Petrauskas. Is this on? And I'm with Johnson & Johnson. Thank you very much. I thought your panel discussions were really informative, and they are really spot on as far as the priorities and the issues that we're seeing. So I have a question that relates to whether or not you've seen some things change in light of what we've experienced with Sandy. That was very challenging, I think, from our perspective as a funder, and that is that being made aware of what the issues are or were at the time, and looking at how do you identify those service providers in communities that are delivering the services to the residents who understand the community, who know the needs of the community, and can customize the services to those. I think the challenge we faced was there was no integrated or coordinated effort that identified who those service providers were. So it would either be housing, or it would be the food bank, or it would be mental health. But has anything changed to connect all of those services so that when people actually coming into the system want to help, there's a way, there's like one portal to go in that then helps provide identification and make aware that support is available, and how then it can trickle down to ultimately impact those communities. And so have you seen it change at all?
Wouldn't you think the long-term recovery group would be your central location? I don't ask my colleagues if they agree with that, but I would think that would be.
I think that that's certainly a place. I think part of the challenge is that each long-term recovery group happens on different day in a different place, and for a statewide organization or somebody who's looking to help the way Johnson & Johnson has and so many of the rest of you have, I think it's hard to know who the right person in the right community is to reach out to, and which long-term recovery group meets on Thursday at the Elks Club. And so to have a a statewide coordinating function is something we've actually proposed to the state and said there should be a one-stop shopping opportunity for supporters to make sure that their resources are getting out the door and that you're finding out what the need is in various communities. And so I think there's more conversation about making that happen. I don't think it's happened yet. I hope that it will by the time that we're done. I think that's a lesson, to the Schaefer's point earlier, a lesson we can all learn about how we organize ourselves. And that's one reason why we've really pushed this community recovery center process, because at least that way they would be coordinated across the state and they'd be collaborative and they'd be organized by nonprofits who are already in the community, already doing the good work that so many of our colleagues are.
Just 2 quick points on that. It's gotten better. Because now there's greater understanding and a tremendous amount of willingness. And so we're starting to build. But remember my story about infrastructure. It didn't exist. It wasn't there. It wasn't there as on a sector-wide basis. Pre-recession, we were trying to get a handle on that, and then we were hit with Sandy. Some of it was literally wiped out. And so there at least there's willingness and there's more understanding of what this is. We've learned very quickly. But the other piece that you mentioned on the one entry point, it's not one entry point. We've talked a lot about marketing and outreach. People need multiple entry points. They need to be coordinated and integrated. When we learn, and you know this maybe from a marketing perspective, from an education perspective, you need multiple exposures to the same information, whether it's changing your habits on food or anything else. So we need to be more coordinated, and that's hard, because you're not marketing a product or a widget. You're marketing complex 10-pound of paper solutions. And so it's a very nuanced way of trying to identify clients as they come to you, not just for the service that they came to you. That's your opportunity to build trust and deliver on something. But you also want to start building on and identifying what else can I do for this family. So it's almost like we provide case managing on an opt-out basis, not on an opt-in basis. And we do it by very subtly seeing, well, what else is going on in your life and introducing it. If you come to me for food, I give you food first. If you come to me to get your taxes done, I get your taxes done first. But then I tell you about SNAP, I tell you about health insurance, or any of the other partner programs that we may have a handle on. But it's very difficult because we're just learning these programs as we're trying to identify what's the best marketing language for our clients. Because we've been trained to think that these programs are not for us. This is a suburban, working class, middle class community that now finds a need where everything around you is telling you these programs are bad for you. Government is bad for you.
You shouldn't ask
Charity,
for help.
why do you
Right.
need help? This is America, you can make it. It's a very different reality from what we're being told otherwise, or what our clients are being told otherwise. So we have to get through the stigma and the emotional and the psychological barriers that kind of come with that, just from a marketing perspective.
Other questions?
Hi.
Oh, Kiki, go on.
Hi. Can you hear me?
It's not about hearing, it's about the film.
Okay. My name's Kiki Jameson. I'm from the Fund for New Jersey, and I appreciate the presentations. One theme that's resonating for me is the interconnectedness of these challenges and issues and the importance of an integrated, sometimes consolidated, but often personalized way of helping people who are affected access those services. One question I have is about the Build It Back program you mentioned in New York, and I'm wondering if there's a role for philanthropy in helping to make more systematic and perhaps even more strategic this integrated, multifaceted way of connecting people with the things they need.
Absolutely. In fact, Build It Back, I neglected to mention, even though I talk really fast, getting all of that information in 8 minutes is a big challenge. So I neglected to mention that the Build It Back program housing counseling element is entirely funded through private sources. It's a philanthropic endeavor that Mayor Bloomberg started and that I believe Mayor de Blasio is going to continue to support housing counseling, so that way the CDBG money, the federal money that's coming down from the federal government, can go directly to helping people rebuild their homes or provide additional rental apartments through construction projects. The Build It Back program's counseling services are entirely funded through the Mayor's Fund. I believe they've raised about $12 million towards that fund already, so it's a pretty comparable amount to what we've proposed could be done here in New Jersey. And so philanthropy has a huge role to play and could in fact take that on. I would encourage you to consider taking it on as a project.
I also have to say the scale of what you've described, 12 million, 15 million for what you, that's not at the range of numbers that I think people would have thought it would have been a much
A
higher
gajillion
number.
dollars, right? We can
Yeah.
add a zero.
Right.
But we don't, I don't think we need to, and that's the thing, is that this does not have to be very expensive. It just has to be very good. And it can be if people work together and have a common goal at the end, that they want to see people get the help that they're entitled to and help navigate that system. Housing counseling works. HUD did a whole report on it. I can summarize it very shortly. Housing counseling works. You can read the report for yourself, but that's the upshot. And it's not very expensive. It just requires an upfront investment in people and talent.
Funder questions? Do we have any other? Oh, okay. She's coming with the microphone for you.
Behind you, sir.
First of all, for truth and advertising purposes, we are the Atlantic City Long-Term Recovery Group. We have multiple ones in Atlantic County.
Right.
We do work with the county group, but I just want to be sure. And we have a great relationship with Vicki Phillips in the county.
Oh,
so
good.
we don't have any problem with their communication.
Okay.
My question is, I agree that there are multiple entry points that can be a spot where someone gets information about other services. But when you speak about, I think you called it community recovery centers, are you talking about a centralized communication point? Is that what you're talking about? My only suggestion is that they be really community-based and that we not give the folks we serve another state number to call
No,
to get
we've got
information
that.
or something. Yeah,
right.
we've tried that. That hasn't worked.
No,
real
we're
well.
talking about actually housing those services all in one place in a one-stop shop in a nonprofit that already exists. That's how Build It Back works in New York. Our sister organization, the Association of Neighborhood Housing Developers in New York City, coordinates the Build It Back program with the nonprofit so that you can walk into any nonprofit that's part of Build It Back and make an appointment. It probably takes all day, but to actually be physically located somewhere where people already go. One of the challenges we saw with the recovery under HGI was that they rented out buildings in places nobody could get to. The Monmouth County recovery location was in Freehold. It wasn't near even where the damage was. And it was very frustrating for people, especially for lower income folks who may not have access to a car or may have to borrow a car. Gas is expensive. They should be in places where people already go, and that's where most nonprofits already operate. So the long-term recovery groups could partner with a neighborhood center like that.
Great, thank you. We'll have time for more discussion and more questions at the end. I want to thank the three of you so much for all the
Thank you, Nina.
great information that you've provided, for all the really, really important, great work that you're doing.